Hi, welcome to Facebook Live. I'm going to take my mask off so you can see my face. I'm Dr. Annette Mercatante from the Health Department.
And I'm Justin Westmiller from the Homeland Security and Emergency Management Division.
The dynamic duo.
That's right.
And we're here to answer your questions. So every week we start out with a little data to share with you what we're doing. I'll answer one or two questions that have come in previously, and then hopefully you'll be sending in your live questions. So for today's data, you have seen this, I'm assuming. We've had 3 new cases since yesterday. We continue to have a low but steady amount of cases every day or two. Only 1% of our hospital beds are currently COVID related. So our hospital system is in a very good shape, and they have been reporting an increase in just normal ER utilization. So if you're sick, go to the hospital, you're fine. Next. Our mapping. I will say again that we've recently reviewed the amount of cases in each one of these areas relative to the population. And I'll say again, there does not appear to be any hot spots, particularly in the areas that have the most cases. The most cases are there because that's where most of the people live. So we'll continue to look at that information and compare the number of cases with the population and make sure that we don't have any areas that seem to be disproportionately impacted. So far, so good. And then this is kind of our key graph. This is the graph that we'll be looking at for business reopenings and making sure that we're not moving in the wrong direction. And this is the average number of new cases per day. And you notice we don't use new cases every day because the graph would be going like this. So we average them out and then we display it in a weekly, and you can see that there has been a steady decrease really since the peak. Despite a few little blips, overall, a very steady downward slope of new cases. So that's very positive. The other thing we can say about new cases is almost all of them now are linked to a known case. Before, we were having lots of cases were popping up without any really known exposure. That's what we call widespread community transmission. And that does not any longer appear to be the case. So if you get a COVID case, typically it's because you've been living with somebody who has a case, and so it goes. So this is good. This is good news. And the next slide.
Before we move on, Doc,
yes,
we've been waiting a long time for you to say that, too. I mean, right? That's
well. Again, and it's really hard to say that with confidence because of our small numbers. So we're going to continue to watch that, but it's certainly after weeks and weeks of this, we've looked at that data a couple of times now, and we just don't have a lot of cases that have no known exposure. Right. So that's a really good sign. Again, if you have widespread community transmission, more and more people have cases where they don't know where they got it from.
But one thing we're getting a little more confidence in that is we're seeing that across the entire region too.
I believe so.
Right.
Yeah, I think that's why we're seeing the governor opening things up,
right,
and we're moving into these different phases. And then our testing data, which is also a very important component to keep track of. Obviously, we want to see average daily number of testing going up. You can see we had a peak there the week of May 17th. And we've come down a little bit, but again, these are variable, and I am confident that we're going to continue to be able to maintain our testing capacity. And I can say some of this is because people are no longer all that interested in getting tested. Right. It's no longer the big fear that it was, and even though we have testing capacity, those sites are reporting less and less demand for testing. So some of that is reflected there, but you'll also see the red line. The red line is the percent positives, and that is an important number as well. So if you have more testing and more cases, or more positive, that means you're finding more cases. But if you have more testing and less positives, that's obviously a trend. It means there's less disease, generally what we're talking about in the community. So that's a good, and we're going to continue to monitor that weekly. And then last but not least, next slide is our dashboard. Please visit our dashboard at scchealth.co, where we keep everything updated. You can get a lot more granular on that dashboard and hover over some of the dates and see specifically what happened on those dates. Again, be careful with individual numbers in a small community like ours. Individual numbers can fluctuate just randomly, statistically, just by random happenstance. So it really is these averages and these trends that are going to tell us what we need to know. There was one more question about data, and that was, what is the average age of people who've died in COVID in, this is St. Clair City, but St. Clair County, and that is, the average age is 73. So that kind of goes along with what we know, is that older people do seem to have a greater risk from this infection. And I also checked, someone had asked earlier whether or not we'd had any pediatrics hospitalized from COVID, and the answer is no. We have had no children hospitalized from COVID. So next.
All right, so yeah, I'll start with the first question. So obviously this week has kind of been a very transitional week, and it's been it's been an exciting week for our residents and our community, because we have had the opportunity to start opening up some things. Now, we've couched some of that excitement with, I know there's some risk in the community and some trepidation on that risk. And we're working, I know Doc and I and the whole staff here at the health department and in the EOC has been working through some of that risk and managing that risk. And so one of the questions that we received was, with the latest COVID-19 restrictions lifted by the government, what might the summer look like for residents in the Blue Water area? So I know we've answered a lot of questions on how to do outdoor events like concerts in the park. And we know that places like Algonac are going to start concerts in the park. They're going to have one tonight. And they're going to be held to have 100 people restriction, right? Spaced apart at 6 feet apart for non-families. So they're going to work through all those things. There are still restrictions. And we're going to follow the governor's EOs, and they have plans and processes to do those things. But we do get to have these things now, which is far off from where we were a week ago. So we're excited about that. We expect that these things will continue to change, and what we ask our community to do is be flexible. Understand that we are working these issues as they come to us and as they change. And these things are going to change constantly a little bit throughout the summer. So each and every one of you, we just ask, be flexible. Don't shoot the messenger. We're working through it. And we appreciate everyone's ability to work with us, okay?
People are very quick to kind of comment on sometimes the inconsistency of the orders and such. And all I can say, and I'm not defending anyone, but this is complicated. And the devil's always in the details. Right. So you can have a general idea, but then there's all these little details and that you really can't really accomplish through a general order. So we just have to work through these one at a time.
And the other thing I want to point out is we could give you guidance on something, and then the state could come out and say,
that's not what we were thinking.
Yeah, here's what the actual guidance is. And it could be completely contrary to what you're given from the EOC or from the health department. And then
hopefully not.
Hopefully not. We're working hard to make sure that doesn't happen. Yeah. But if that in fact does happen, then we have to come back out and fix that and understand that that is not our intention. We are hopefully not going down that path, but it may happen. And we're going to need you to work with us on that.
Because we're interpreting those gray areas as well. So someone says, can I do this? And we look at the emergency orders and the guidance going, I can't tell based on this. So we take an estimate. Sometimes we try and be more liberal with it. Sometimes we feel that there might be some more risk to that. And we're really basing that, I think, I'm hopefully making those decisions mostly on what I really think the risk is to an individual doing something. What is the risk? What is the benefit? You're going to see me do this a lot. And sometimes you have to accept some risk if you think overall the benefit supersedes that. There is probably nothing we're going to do this summer or in the fall that is risk-free. I'm going to say that over and over again, because there is no such thing as a safe reopening. There's a safer reopening, but there is going to be risk involved with every step of this, and we're just going to have to be prepared to respond to it.
Yeah.
We can do that.
Our promise to you is we are working as hard as humanly possible to make sure it's a safe, comfortable reopening while doing what we can to mitigate the risk to our community. So.
Do we have any questions?
Yeah, we have a couple.
Good.
Okay, the first one is, what counties are most of the new cases coming from in Michigan?
Oh, that's a data question. Do you think you can pull that out?
I can pull it up.
And the question is, what counties are most of the new cases coming from? And again, we're going to have our data people take a look at that. But do understand then, you're talking about new cases, numbers of cases, and they are going to come from areas that have more people. So that doesn't necessarily reflect the risk of that community, okay? Now, one of the things I have heard is we're seeing a shift from the southeastern Michigan area to some of the more western sides of the state, and maybe even some bleeding up into the northern Michigan components as we travel more. But we'll get back to that question, hopefully answer it better.
Yeah.
Next question.
Okay, the other question
It's the Grand Rapids sector.
Yeah.
can active cases be shown by city and zip code?
Well, active cases are difficult because it changes so much based on our ability to contact those individuals, talk to them, identify the onset date, etc. And their symptoms can change. So it's very difficult. It's much easier to report who's recovered. And so the difference between recovered and active is the difference between the total and the recovered. So you can do it. So the question here is, and I'm sure where this question is coming from, is you want to know where the active cases are so you can avoid doing that, right? And that's valid, except that our fear is it will falsely implicate individuals or locations. Because this really isn't about, as I mentioned, hot spotting. We're watching that, but there is, in fact, no real way you're going to avoid an area that has no COVID cases in it. Go back to our data. So going back there. So, you know, if we have one case in the village of Emmett, guess what? We've just told the entire state, really, that who that individual is, because Emmett's small and everyone's going to know. So we do have to be careful about protecting personal information.
Right.
But the intent of that is, where am I at risk? And I would continue to proceed with you at risk anywhere you go where you are within 6 feet of an individual without a mask.
Right.
That is the risk, and that's why, you know, I want to answer one of these questions real quick, because one of these questions is, as the weather gets warmer, I'm really uncomfortable wearing my mask, and I'm concerned about being able to breathe. It's a great question. I had to wear a mask today doing some clinical work, and it was uncomfortable. The air wasn't so good. Here's what I would advise you. First of all, if you're really getting uncomfortable, excuse yourself from the company of other people and take your mask off and relax and breathe, okay? Again, it's intended, and here I am talking to Justin because we're probably within 6 feet.
We're close, but
close.
Yeah.
But it's intended to protect Justin from me.
Right.
So if you don't want to expose somebody near you, you wear the mask. If you can't wear the mask, just excuse yourself from their presence. Try and avoid that close contact. So if you're walking down the street in the warm weather and there's no one around you, you don't need to wear your mask for that. Take it off and relax. Keep it in your pocket, or you can throw your mask on. That's kind of how I do it, because I certainly understand wearing it all the time is just a no-go.
Okay, next.
One more thing I've thought of, and this is not evidence-based in a strong way, but if you really can't wear a mask, an option is a face shield. Okay, it's something that we've been discussing with the medical directors, and I know it's not been proved, but it still will restrict the ability. Now, face shields are probably hot too, but they're probably not nearly as bad as a mask. So that's something to consider if you really, really can't stand this, is just get one of those face shields and you can throw it on when you're close to somebody. Okay, sorry.
Okay, there's 2 more questions that have come. How many gastrointestinal cases versus respiratory there are?
Oh, locally, I don't know that we've pulled it. We have that information. We do have some symptom-related data in our database. And I think the last time we looked at it, I don't know, I'm looking at Brandon. I think we're going to have to get back to that as well. I think that's going to take some hand review, like case by case. That may take a little while to compile. I can tell you that some of the statewide data that I've seen is reporting gastrointestinal to be relatively low. 10 to 20% of the cases are presenting with gastrointestinal symptoms. Primary symptoms remain cough, respiratory, shortness of breath, and this fever. But those are 70 to 80% of the time too. So no one said, and the lack of taste and smell seems to be higher than the gastro piece too.
Okay, next question. If you have a procedure done in the hospital, should you still self-quarantine for 14 days?
A procedure done in the hospital, and then after the procedure, so the question is, if you have a procedure done in the hospital, should you then self-quarantine?
Should you still self-quarantine for 14
That's
days?
an interesting question, and I would have to say no, and this is the reason why I say no, is our hospitals are probably being the most conscientious and aggressive on screening people for COVID. So before you go into the hospital for a procedure, generally speaking, you're going to have a COVID test. Okay, this is not so true for all of our ambulatory surgical centers, but your risk of getting exposed in a medical situation, I think, again, is much lower than going to a crowded Meijer store where no one's wearing a mask, because our healthcare providers are following infection control processes all the time. I mean, believe me, they don't want to get COVID either, so they're very careful about breathing and wearing masks and being, exposing you and being exposed. So the answer to that question is probably not based on a medical procedure. I would not self-quarantine following it, unless, of course, your doctor advises you. Otherwise, always follow your doctor's advice. But in general, that is not advice we're giving to people.
So follow-up to that was, how about on an airplane?
How about on an airplane? So yes, if I traveled on an airplane, I would if my son came home from an airplane ride or travel, I would ask him to hunker down for 14 days. I think travel on a plane is intrinsically a little bit more dangerous, if you will, or risky than driving in a car to another location, only because your car is your enclosed place with people that you know. Where at a plane, you're just automatically getting exposed to just a large number of people, and there's a lot of mixing of air. So I would say flight travel would elevate that level of quarantine if you can. And of course, there are exceptions to that. If you're an essential worker, we still say, even with a known exposure as an essential worker, you can work under certain circumstances. So it would depend on your situation. The other thing you would want to self-quarantine is if you had a known exposure or you went somewhere where you knew there was an outbreak. Okay, so if you go somewhere, anywhere in the country, I'm assuming people aren't traveling to foreign countries yet, but maybe you are.
No.
But if you go to anywhere in this country where you are aware of high rates, and nowadays you can just Google the city you're in and see if they're having a problem or going up or down, those people returning from that, I think, should be a little more careful.
Okay, 2 more questions have come in.
Okay.
Do asymptomatic people have a fever?
No, by definition, if you're asymptomatic, you
Symptoms.
don't have symptoms. You do not feel ill, and there are no outward signs of illness. So you would be completely, if you had a fever, you're symptomatic, really. So that's kind of, it defines the thing. So an asymptomatic infection means you can culture the virus, but the person does not feel ill in any way. And we know that that is true in a fairly substantial number of people. I don't know at this point whether it's going to be 10% or 20%, but we're seeing ranges all the way up to 40% of a population with that. So we have to be careful with that.
Okay, next question. Do you anticipate a second wave of an increase in COVID cases due to a reopening of the state?
You want me to answer?
Well, you can answer first, and then I'll answer.
Do you
So,
want to repeat the question, John?
yeah, so the question is, do we anticipate a second wave due to the reopening? And I think the answer is there's always a potential, and we in St. Clair County, our Doc and I and our staffs are planning to be available to respond should that happen, right? And so
Plan for the worst.
That's right.
Hope for the best.
Yes.
And that's exactly what we're doing.
That is
I
what
do
we're
not
doing.
want to say doom and gloom.
Right.
We're destined to have a horrible second wave. You can look at historical precedents. You can look at viral epidemiology. And all of those things suggest that it is a relatively likely, but not automatically absolute.
Right.
So we're going to plan for the worst and hope for the best.
Yep.
Okay. Where can we get COVID antibody testing done? Where can we get that?
Well, your doctor can order it. They can draw blood and send it off to a lab, and it can be done. And that's probably the best way of getting it done. Having kind of a drive-through antibody testing is not being offered or recommended by anyone because antibody testing is not really useful to you as an individual. You cannot say that you have or had not had the infection based on a negative test because we don't know how many people actually mount antibodies and how long it takes them. If you do have an antibody, you cannot say that you're immune. So antibody testing at this time is really useful for what we call population level assessments. If we did antibody testing in enough people, we could get an idea of how many people had a previous infection, because an antibody would indicate you probably had a previous infection, but what can you as an individual know based on that information or do? And the answer is not much. You're better off, if you think you have the infection at this point, is to still get the viral PCR testing. That is still the gold standard. If you get an antibody test and it's positive for an IgM antibody, we are still highly recommending that you get the PCR test, because that's how we can decide if you have an infection or not.
So someone is asking about accuracy of the antibody testing.
The accuracy of the antibody testing is all over the board, which is why we're giving you this advice. I am hopeful and confident that we're going to get there, and we're going to be able to say, here's the tests, and this is what it means, and this is the percentage of false positives and false negatives. The problem is the FDA has authorized a whole slew of these under an emergency use authorization. The data and the studies aren't there, and what we have found is that a lot of these tests are so unreliable, it's like 50-50. So if you get a test, it's like 50-50 that you can believe it. So it's difficult. The best ones probably are the blood draws that are going to like a LabCorp or a validated lab. Those probably have a reliability closer to 95%. And the value of that is dependent on how much infection is already in the population. The predictive value, we're going to get into a whole other level, but predicting how accurate it is really twofold. The quality of the test, the sensitivity and specificity, but also how much disease is in the population. And in a low rate population like ours, those antibody tests get a little tricky to interpret. So more to come.
Okay, do you want to go off your sheets
Yep.
now?
So I have another question. Besides COVID-19, what other issues are the EOC dealing with currently this week? So we're dealing with flooding. We're at the highest level right now we've been. We set another record in May of 2019. We were almost 4 inches higher than we were in 2019 for the month of May. And you can see that as we've flooded a couple of houses. We've had some pretty significant damage issues in the southern part of our county. Right now, in parts along the St. Clair River, you can almost literally walk from the land right over the break wall and into the river. It's that high. So we're still monitoring that. We're again today.
Don't walk into the river. I wouldn't recommend it.
Don't walk into the river, but you can. We're monitoring that again today because we've got high winds that are coming tonight and tomorrow night. So we've got that going on. We've got demonstrations happening in our area here in the next few days. So we're keeping an eye on those things. We're managing COVID-19. We've had some chemical spills and oil spills. Those things are normal, but they're ongoing. So
he's a rock star.
We've been very busy.
Okay, the person who asked about
the
counties with the most new cases, Brandon has that answer now.
Oh, okay.
So it's going to be Detroit, Genesee, Ingham, Jackson, and Kent.
Okay, so the counties with the most currently number of cases are Detroit, Genesee, Ingham, Jackson, and Kent County.
For new cases.
For new cases. And again, these are highly populated cases. Jackson is actually our size, but it's got a huge prison there, so I imagine that's got something to do with it. And so there you go. So it's not gone. What's the take-home message here? COVID's not gone, people.
Right.
It's still around, and it's just a hop and a skip from a trip over to some other county or community. So continue to be vigilant and careful.
Absolutely.
Okay, it's 3:57.
Okay.
So you guys
so
have
fast.
different questions you want to answer? And
I have
then
one
we'll
more.
wrap up.
Yeah.
Okay, so one more that's a hot topic is kind of an update on the nursing home testing. And we are making great progress with that. We're getting great cooperation from all our nursing homes. We have now tested every nursing home, and almost all of them are on track to get all their staff done as well. And we've started testing some of the smaller facilities as well. I'm happy to say that by and large, we're doing pretty well in our nursing homes. We've got some nursing homes that are just like rock stars. They're like no cases at all. There's a few cases in some. The ones that have more cases are working very hard with us and are cooperating well. So I'm optimistic, and I think we'll be able to keep a lid on this, which is the goal, right? It's a vulnerable population, and we want to make sure that they can live safely in the environment that they're in. So, good question.
Yeah, and then finally, what guidance can you provide youth sports groups and parents on how to proceed with the season related to the governor's recent changes? So we've been working with all the Little League groups around the county, and we think we've pushed out some pretty good guidance to them, and we continue to answer their questions as they come to us. There is no guidance available yet on football and soccer seasons. We know they're upcoming. They start in the August, September timeframe. So we expect to work with them. We also expect more information to come from the governor and the state on those. So we're working and we're waiting and seeing what's happening with that. There's also quite a bit of information flowing around about high school sports. It's a little bit TBD on that as well, but we do work with our school districts on all of that, and we're working with them. We're in a work group with them to deal with that. So all of your school districts have information, and you should expect to see information come from them very soon. So if anybody has any other youth sports group information, please reach out to the EOC, and we will be able to answer your question.
And how do they do that, Justin?
You can reach the EOC, what's the situation at stclaircounty.org. Sorry, it's been a long day.
Situation without an S.
That's
Well, I mean S.
Yep, situation.
Situation.
Yep, situation.
I always put the S on the back.
Yeah. So
Like situation.
situation at stclaircounty.org.
Or COVID-19, right? At
Yep.
stclaircounty.org.
At stclaircounty.org.
And that'll get to us as well.
Yep.
Okay, any last few minute closings?
Yep. So again, I'll say it. It's been a very interesting week. We've made a lot of changes this week in St. Clair County. A lot of positive changes, as Doc has talked about. It comes with risk, right? We're going to accept some risk, and we're going to do some things so that we can start opening up. We're going to open up businesses, restaurants, and quite a few other things next week on the 8th. And that comes with some additional risk, but you will be able to get out in the community and get to the bars and get to the restaurants and enjoy yourself a little bit out in the community. Please wear your masks.
Personal responsibility.
Personal responsibility is going to be a big thing.
Try and stay away from people when you can.
Yep.
And please, if you're ill, if you feel sick, don't go out. Isolate yourself, self-isolate yourself. And really, nowadays, we can get a test. By the way, we need to mention the fact that we will be providing here at the health department free COVID testing. Yes, it will be the PCR, but that's the most accurate. I told you that. And you don't need a doctor's note. We can do it through me. And so you just need to call for an appointment, please. It's 987-5300, 987-5300. There's still openings for the first testing, which is Tuesday, and these are going to be every Tuesday from now on. We'll see how the need is. Right now, it's just going to be in the mornings, but we'll adjust as needed. So if you're sick, consider a test. If you've been somewhere where you might think you may have been exposed or at risk, consider a test. If you're going back to work for the first time after a long time and you're nervous about it, consider a test. You do not have to have symptoms to get a test. We'll test anyone 18 and older. We're going to hold off on the kids. Go to your pediatrician if you have a kid or somebody under 18 that needs it. So next week we have a special guest star. So for your physician response, we're going to have Dr. Sweetar Reddy, who's a pulmonologist and intensivist at Lake Huron Medical Center, to answer your medical questions. And of course,
that is a gentleman far smarter than me. So hopefully I'll be able to keep up.
Think of those stumper medical questions. He's a brilliant man, and I'm sure he's going to have some great information for you.
So
thanks a lot, everybody.
Thank you, everybody.
Be safe and take care.
Have a great weekend.